In this section of the audio portion of our presentation, I will be discussing the background and focus areas of the poster. I will then briefly discuss my personal findings and their impact and implications. As stated on the poster, adolescent substance use is a major issue in the United States. While a large amount of attention has been paid to reducing substance use among both adults and adolescents, much less attention has been paid to treating the mental health issues of adolescent substance users. There are some national and statewide resources for substance users with mental health disorders, but there are very few organizations tailored specifically to treat the mental health issues of adolescent substance users. Since therapies like cognitive behavioral therapy and family therapy are used to treat mental health disorders in non-substance using adolescents, our group decided to investigate which therapy is best at treating mental health disorders in adolescent substance users. We define mental health disorders as a damaging excess of a normal emotion, such as anxiety, or a diagnosable disorder, like schizophrenia or depression. Our definition of substance use follows a DSM. Our guiding PICO question is listed on the poster, and our focus areas are all the different types of therapies we investigated. I was tasked with investigating the effect of combination CBT and MET compared to CBT in improving the mental health of the selected population. My initial search of the literature yielded 50 papers, and 5 of these papers were chosen to be analyzed. The papers by Rode et al. And Cornelius et al. Used their own conclusions and extensive reviews of the literature to establish the effectiveness of CBT in treating both substance use and mental health disorders in adolescents, making CBT the cornerstone of treatment. The papers by Guo et al., Holverson et al., as well as Rode et al. Found that a combination of MET and CBT are highly effective in treating substance use and mental health disorders in adolescents, owing to the motivation to continue treatment and abstinence that MET provides. The paper by Davis et al. Found that a combination of MET and CBT is extremely effective in reducing opioid use in adolescents in the short term, but fails to present the effects on mental health, reducing the usefulness of this paper in our poster. Finally, the paper by Holverson et al. Used an extensive review of literature to confirm that a combination of therapies, not one or the other, is the most effective in improving the mental health of this population. This, along with the fact that more research needs to be done on the topic, are the major implications that I found. All the papers discussed in this audio recording can be found in the reference section. Thank you.
Hello and welcome, everyone. My name is James Blau, and in this research, I was responsible for analyzing the effectiveness of family therapy for its use towards adolescent substance use. First, I'll start off with giving a brief introduction to the definition of family therapy. Family therapy, or specifically brief strategic family therapy, as there are many different variations of the treatment of family therapy, is a present-oriented, problem-focused, directive, and practical approach to treatment. It focuses on improving family functions by identifying alternating patterns in family interactions that are directly related to the adolescent's substance use and related towards behavioral or associated behavioral problems. Family therapy aims to improve this through parental leadership, parental involvement, and positive parental practices within the family and within the home. All of these have been shown to serve as protective factors against adolescents, preventing substance use and the negative effects of deviant friends, neighborhood crimes, and underperforming schools. While analyzing existing research, it was found that there to be great limitations in the data that was a result of the subject population that was being analyzed not accurately representing or taking into account minority groups, specifically groups of color and impoverished communities. While some of the papers did mention that further research should be conducted into culturally sensitive therapy methods for specific communities, it has yet to be wildly examined. This creates a limitation as most communities that are the most at risk for substance use and abuse in adolescence are not being adequately considered for research studies, or due to limitations of economic mobility and access from researchers to these communities, are being left out. These sort of things are a huge issue, as these groups are some of the highest risk for addiction and mental health issues, and they are systematically being left out of being conducted in these research groups.
My name is Tara Simundong. For my portion of the poster, I discussed how 12-step programs compared to CBT help improve the mental health of adolescent substance users. I was able to find 44 articles, but narrowed it down to 5 articles to help my PICO question. During the research, I found that 12-step programs were utilized for the first year after treatment for adolescents, but started declining as the years progressed. It was found that 12-step programs did not relate to adolescents as it does to adults. This reason would be the spiritual aspect that 12-step programs have. So catering a program for adolescents that relates to their developmental growth could help increase the likelihood of abstinence. One of the articles I found did talk about the adolescent substance users with a risk of depression. It stated that having some type of CB prevention intervention could be beneficial for delaying or preventing the increased use of substances. Going through the research, it shows that 12-step programs do work, except they work better with some other type of intervention. So having no intervention for this population is very detrimental to their health and well-being. Another finding showed that adolescents thought that therapeutic activities were not as useful as lifestyle changes. These lifestyle changes included finding a job, going back to school, and becoming involved in extracurricular activities. This could help the future of nursing practice because it shows that adolescents do want to change the outcome of their future, but they're not giving the proper resources or education. As healthcare providers, educating and finding other modalities could help adolescents through adulthood. As a quick recap, we would like to highlight that any type of intervention that is being used, like MET, family therapy, and 12-step programs, work best when paired with cognitive behavioral therapy. More research needs to be conducted on the improvement of mental health of adolescent substance users, and improving nursing practice could help treatment for adolescents through adulthood. My group, Samuel Anthony, James Blau, and myself would like to thank Dr. Pamela Adamschick and Dr. Karen Grola for assisting with this literature review. We would also like to thank the entire conference for taking the time out of their day to be here. Thank you.